When using crutches, you need to put the weight onto the palms with a 2 to 3 finger width gap from the top pad to the armpit. Do not have the arm straight or a large bend in the elbow. There should only be a slight bend. You should have the crutch tips a little more than shoulder width apart. With a 4-point gait, advance the right crutch, then left foot, advance left crutch, then right foot, right crutch, left foot, left crutch, right foot, and so forth. For a 3-point gait, advance both crutch tips forward, then hop with the non-injured leg to the crutches. This is also called the swing to gait, as you're swinging to the crutches and not past them. For a 2-point gait, advance right crutch, then left foot at the same time, then left crutch and right foot at the same time. Another variation of the 3-point gait is the swing through gait, where you advance both crutch tips forward and then swing through past the crutch tips. This type of gait is more advanced and requires a high degree of coordination. When you are going to sit in a chair, make sure you can visualize where you are going to sit and have the back of the leg touch the edge of the chair. Hold both crutches in one hand, place a hand on the armchair, and slowly sit down. When getting up, make sure the patient has the crutches in one hand and the other hand on the chair of the arm. Have them push off from the chair arm, handle of the crutch, and stand on the uninjured leg. Place the crutches in each hand and then prepare to ambulate. When using stairs, a saying to remember the proper sequence is up with the good, down with the bad. Hop up the step with the good leg, then bring up the crutches. Repeat as necessary. When descending stairs, place the crutches on the lower step, followed by the injured leg, then hop down with the good leg. Repeat as necessary. This method of going up and down stairs is the most dangerous and requires a high degree of coordination. You can also hold onto both crutches in one hand while holding a handrail with the other. Hop up to the next step with the good leg, then advance the crutches up to the same step and bring the uninjured leg up. Slide your hand on the handrail up to the next step and repeat as necessary. When going down, you will lower the crutches onto the lower step, slide your hand down the rail, lower the injured leg down to the same step the crutch is on, and then hop down with the good leg. Another way to go up and down stairs is to hold both crutches in one hand and sit on the bottom step. With your free hand, put the palm onto the higher step and push off with the good leg in hand to lift yourself onto the next step. Bring the crutches up and have your injured leg follow. Go down the stairs by lowering the crutches, lower the good leg, lower the free hand, and lower down to the next step. Repeat until at the bottom. You can also place the crutches higher up on the stairs and then sit down and lift yourself up to where the crutches are. Repeat until you're at the top of the stairs. Going down is a similar way of lowering the crutches down the stairs, having a seat at the top of the stair, and lowering yourself down. Repeat until you're at the bottom step where you can stand up and ambulate. The safest option is to avoid stairs or use an elevator.